Hi, how are you?
Good, how are you?
I'm good. My name is Audrey. I'm going to be the healthcare provider taking care of you today.
Okay.
All right, and how's your day going so far?
It's going well. How about yours?
Oh, it's good. You know, it's a beautiful day, so I can't wait to get out of here and enjoy the sun for a little bit.
Yeah.
All right. All right, so I'm just here sanitizing my hands, putting my gloves on, and now we're going to get started, okay?
All right.
So, this first part of the exam, I'm just going to be asking you a few questions. Just bear with me. It's a lot of questions, but we'll get through them. All right. The first thing I'm going to want you to do is I'm going to give you 3 words. I want you to immediately repeat them back to me, and then I want you to be able to remember them. Okay? So 3 words is money, truck, and blue.
Money, truck, blue.
Perfect. Patient's immediate memory is intact. All right. Now, can you tell me your full name and date of birth?
Susan Thompson, 1864.
Perfect. Can you tell me today's date?
Today's date is October 3rd, 2024.
Perfect. And can you tell me where we are?
I'm at the doctor's office in the clinic.
Perfect. And can you tell me why you're here?
I'm just here for a routine checkup.
All right, perfect. So patient is orientated to person, place, time, and situation. Okay. Now the next thing I'm going to have you do is test your cognition and attention. Okay. So I'm gonna first ask you to spell the word world backwards.
Okay. It's DLROW.
Okay, perfect. And can you count backwards from 100 by 5s up to the number 75?
Okay, so 100, 95, 90, 85, 80, 75.
Perfect. All right. So patient's cognition and attention is intact with limited distractibility. All right. So now what I'm going to do is I'm going to ask you a question. Okay. So tell me, if you were walking in the street and you came across an envelope that was stamped and addressed, what would you do with it?
If it was already stamped with an address, I would just give it to the post office.
Okay, perfect. So patient's judgment is intact. Okay. And now what I'm going to do is I'm going to ask you to repeat this sentence. Okay.
Okay.
Today is a sunny day.
Today is a sunny day.
Okay. And then I'm gonna have you repeat another sentence. No ifs, ands, or buts.
No ifs, ands, or buts.
Okay. So patient's speech is normal with normal rate, tone, pace. Okay. Patient is also well groomed and appropriately dressed for the weather. Patient is maintaining eye contact with me throughout this examination. Patient's body habitus and posture is normal. Patient is cooperative during this interview. Patient activity level is normal for the situation. No sudden movements or impatience noted. No pain or discomfort is noted with the patient. Patient's affect is also appropriate for this examination. Now, I told you 3 words at the beginning of the exam. Can you tell me those 3 words again?
Money, truck, blue.
Perfect. Patient's short-term memory is intact. Now, I'm going to ask you a question. Tell me, do you remember who the president was before Trump?
Obama.
Perfect. Patient's long-term recall is also intact. All right. And now I'm going to ask you, so tell me, what do you do for work?
I'm a full-time student.
Okay, what are you studying?
Anesthesia.
Okay, perfect. Can you tell me a little bit about that?
With anesthesia, we basically administer medications along with other procedures to help facilitate and guide patients during surgery.
Okay, perfect. That sounds really interesting. All right. So per patient is flow of thought is logical. Patient is able to say their thoughts normally. No hallucinations, no delusions noted. Okay. All right, thank you. So that concludes our mental part of the exam. Okay. So now I'm going to move forward with the physical examination. Okay. So now the first thing I'm going to do is I'm going to test your sense of light touch, okay?
Mm-hmm.
So what I'm gonna ask you to do is you're gonna close your eyes for me.
Okay.
I'm going to take this cotton ball and touch certain parts of your body for me. I just need you to tell me where you feel the touch, okay?
Okay. Left arm, right arm,
Gotta expose. I should have had you address a little bit.
Oh, I'm sorry.
It's okay.
Left ankle,
Mm-hmm.
right ankle.
Okay, perfect. So patient's sense of light touch is intact. Okay. All right. And also, if you don't mind just taking your shoes off for me, because I'm gonna end up doing some exams with the shoes and the socks as well.
Okay, yes.
Okay, perfect. So again, we just tested light touch with the cotton ball, and patient's sense of light touch is intact. So now what I'm going to do is I'm going to assess your range of motion of your cervical spine.
Okay.
So you're just gonna follow my lead, and I'm gonna have you turn your head in specific directions just so I can see how well you're able to turn your neck, okay? So first you're gonna take your chin and touch your chest.
Okay.
Perfect. You can bring it back up. Now bring your head all the way back. Perfect. Any pain with any of those movements?
No.
No, perfect. So now you're gonna look to the right, to rotate your head to the right. Perfect. Back to the center. Rotate your head to the left. Perfect. Back to the center. Any pain with those movements?
No.
Okay, perfect. So now you're going to bring your ear to your right ear to your right shoulder.
Okay.
So you're gonna just perfect. And can you do that to the opposite side?
Yes.
Okay, perfect. Any pain with that?
No.
Okay, so patient has full range of motion in the cervical spine and no tenderness noted. Okay, now the next thing I'm going to do is assess for cranial 11 spinal accessory. Just gonna make sure it's intact. The way we're gonna do that is I'm gonna have you do a few movements against resistance. Okay, are you ready?
Mm-hmm.
So the first thing I'm gonna do, I'm gonna put resistance on your shoulder, and now you're gonna shrug your shoulder against the resistance. Perfect. All right. So now I need your head to turn your head this way for me, and don't let me push your head the opposite way. Okay. Perfect. Good. Next. Perfect. Very good. So patient was able to turn her head and shrug her shoulder against resistance. Strength is symmetrical bilaterally on both sides. Cranial nerve 11 spinal accessory is intact. All right. So now the next thing I'm going to do is I'm going to assess your reflexes. Okay. What that means is I'm going to take this hammer and I'm going to go to different parts of your arms and your legs just to assess how well your reflexes are. Okay, so I'm going to be assessing for your triceps, biceps, brachioradialis, patella, and Achilles tendon. Okay, so I'm just going to move your arm if it's okay for me.
Yes.
Okay, so just follow my lead. Okay, so now I just need you to relax your arm. I'm going to bring your arm up like this. I'm going to test for your triceps reflex, okay? All right. Perfect. All right. Now I'm going to do your biceps. Okay. Perfect. Brachioradialis. Perfect. All right. Now I'm going to do the same on the other side here. Triceps. Just relax your arm for me. Perfect. All right. Biceps. Perfect. And now I'm going to do brachioradialis as well here. Perfect. All right. Now I'm going to do the patella on both sides, okay? Okay, perfect. And just relax your legs for me.
Sorry.
Yes, perfect. You're okay. And perfect. Okay, perfect. Now I'm going to do Achilles tendon, okay? So what I'm going to do is I'm going to have you point your toes up just slightly, okay? Not too thin. You're going to keep your legs relaxed.
Okay.
And I'm just going to hit it. Perfect. And same thing on this. Bring your toes up a little bit. And then perfect. All right. So all reflexes are 2+ on both bilaterally. Okay. Now what I'm going to do is I'm also going to test your plantar reflex as well as your proprioception, meaning positioning of your big toe. Okay. So I'm going to take the blunt end of this hammer and I'm just going to slide it up against your foot. Okay. So just point your toes up for me.
Okay.
Okay. Perfect. All right. On the other side. I'm so sorry. I know it's not comfortable. Sorry. I'm so sorry. Okay. And now what I'm going to do is you're going to just look straight ahead of me. Okay. Don't look at me. And I'm going to wiggle your toe a little bit, but tell me in what position does your toe end up in. Okay. All right. So tell me, where's your big toe? Perfect. Again, where's your big toe?
Up.
Okay. Perfect. Patient is able to, patient's toe position, toe proprioception is intact. Patient's Babinski reflex is negative, where no fanning out of the toe is noted. Okay, so now the next thing I'm going to do is I'm going to have you do a few movements. Okay. So first I'm going to have you do the rapid alternating movement. the nose to finger touch, as well as the knee to heel touch. Okay, so first, rapid alternating movement. You're gonna do this movement for me as fast as you can.
Okay.
All right. Okay, perfect. All right, now what you're going to do is you're going to touch your nose, and then wherever my finger is, you're going to touch my finger.
Okay.
All right, so you ready? All right, so touch your nose, my finger, perfect. Touch your nose, my finger, perfect, and then touch your nose, my finger, perfect. And now the last thing I'm going to have you do is I'm going to ask you to take your right heel,
Okay.
bring it up to your left knee,
Okay.
and just drag it down towards your left heel. Perfect.
Okay.
And you're going to do the same thing on the opposite side. Perfect. All right. So patient was able to do alternating rapid arm movements, nose to finger touch, as well as the heel to knee touch, all with smooth coordinated movements. Okay. Now the next thing I'm going to do is I'm going to assess for your pronator drift. Okay. So what I'm going to ask you to do is you're going to bring your arms out like you're holding a pizza box.
Okay.
Okay. You're going to close your eyes. I'm going to count to 5, and we'll go from there. Okay. So just close your eyes. 1, 2, 3, 4, 5. Very good. You can put your arms down. So no downward drift of either arms noted. Okay. So now the next thing I'm going to do is I'm going to assess the strength of your elbows, wrists, and hands. Okay.
Okay.
So you're just gonna follow me with some of the movements I'm gonna have you do. So sorry. All right. So first you're gonna bring your arms straight out to your side.
Okay.
All right. Elbow extension intact. All right. Bring your elbows up. Perfect flexion. All right. Now you're gonna bring your arms down to 45-degree angle, and you're gonna turn your hands down, palms down. Then turn your hands palm up. Perfect. All right. Now what we're going to do is assess the wrist. So now with the wrist, what you're going to do is you're going to bring your hand, like basically bend your hand at the wrist. Very good. Now you're going to bend your hand up at the wrist as well. Very good. Now you're going to put your hands planar, and now you're going to bring your hands in towards your tongue. Perfect. Radial deviation. Now you're going to bring your hands out. Ulnar deviation. Very good. All right. Now what you're going to do is you're going to make a fist for me. All right. Strength of the fingers. Now you're going to bring your fingers out. And now you're going to separate your fingers as far as you can. Very good. And now you're going to bring your fingers back together as tight as you can. Very good. All right. You can put your hands down. So the range of motion in your elbow, wrist, and hands are intact. You have full range of motion in all those areas. Now what I'm going to do is I'm going to have you repeat some of the same movements I just had you do, but now you're going to do it against resistance, okay? So first we're going to go back to the elbow. With the elbow, what you're going to do, you're going to bring your elbow, bend your elbow, your arm at the elbow, as if you're doing a bicep curl. I'm going to put resistance on this side, and you're going to fight me. You don't let me push your arm down, okay? Very good. Perfect. And now you're going to do the same thing and try to bring your arm down. Don't let me keep your arm up. Perfect. Very good. So patient has elbow strength of 5 out of 5 bilaterally. Okay. Now we're going to assess the strength of your wrist. Okay. So with your wrist, what you're going to do is you're going to just bring your arm up, your hand up like this for me. I'm going to put my hand up on this back side. You're going to flex your hand at the wrist for me, and don't let me push your hand down, okay? Ready? Go ahead. Bring it up. Perfect. All right. Now you're going to raise your hand up just like this. I'm going to do this, and you're not going to let me push your hand up. Okay? Perfect. Very good. So also what you're going to do is you're going to bring your hand like this. You're going to bring it close like this. I'm going to try to resist you. You're not going to let me push your hand out, okay? So perfect. And then now same thing. Don't let me push your hand in. Perfect. All right. So patient's wrist is 5 out of 5 in strength bilaterally. So now what I'm going to ask you to do is I want you to squeeze 2 of my fingers. Perfect. All right. Now also what I'm going to have you do is I'm going to have you spread both your fingers apart as far as you can. Don't let me close your hands. Perfect. Perfect. Now you're going to close your fingers like as tightly as you can. Don't let me spread them apart. Perfect. Perfect. All right. Hand strength is 5 out of 5 bilaterally. Okay. Now the next thing we're going to do is I'm going to assess your knees. Okay. Your knees, ankle, and feet strength. Okay. So what I'm going to have you do is I'm going to put some resistance on your thigh here. Don't let me. You lift your thigh up. Don't let me push it down. Okay. Go ahead. Perfect. Go ahead. Perfect. All right, now what you're gonna do, you're gonna bring your legs out for me. All right, don't let me push, sorry, my hair's in the way. Don't let me push your legs down. Okay, perfect. Perfect, all right. Now you're gonna bring your legs down. I'm gonna put resistance on the back side. Don't let me raise your leg up, okay? Perfect. I'm gonna go to the other side. Perfect, all right. So knee strength is 5 out of 5 bilaterally. Now I'm going to assess for your ankle and feet strength, okay? So now what you're going to do, you're going to point your toes up to the sky. Perfect. I'm going to try to push your toes down. Don't let me do it, okay?
Okay.
Perfect, all right. And now you're gonna push my foot as strong as you can, like a gas pedal. Perfect, that's perfect. And now what you're going to do is bring your feet inwards, all right, and don't let me push it out.
Okay.
Perfect, all right. And bring it out and don't let me push it in.
Okay.
All right, perfect. So ankle and feet are strength is 5 out of 5 bilaterally. Okay, so now the next thing I'm going to have you do is I'm going to actually have you stand up.
Okay.
All right, and now I'm just going to assess the symmetry of your trunk, your extremities to your shoulder. Okay, so your trunk and your extremities and your shoulders are all aligned symmetrically. Okay, so now what I'm also going to have you do is I'm going to have you do something called the Romberg test. Okay.
Okay.
So if you could just step off away from the stool, please.
Uh-huh.
All right. So I'm gonna have you spread your legs just apart, shoulder widths apart.
Okay.
All right. Bring your arms out to the side. Perfect.
Okay.
Close your eyes, and I'm going to count to 5. Okay. 1, 2, 3, 4, 5. Okay. You can open your eyes and put your arms down. Okay.
Okay.
Patient. No swaying. No swaying or no swaying or minimal swaying noted during this examination. All right, so now the next thing I'm going to do is I'm going to test your shoulder strength, okay?
Okay.
And first, actually, I'm going to test your range of motion in your shoulder.
Okay.
Okay, so you're just going to do the certain movements for me, all right? So you're going to bring your arms up forward in front of you.
Okay.
Perfect. You can now bring your elbows out for me.
Okay.
Perfect. You can bring your arms back down.
Okay.
All the way down. Now what you're going to do is bring your arms all the way back for me. Okay, perfect. You can bring it back to the side. Now what I want you to do is put your arms in a 45-degree angle and then bring your arms out like that. Perfect. And then now you can put your arms down. Bend your elbow up, bring your arms up like that. And then now just bring your arms. Perfect. All right, and then now you can bring your arms down, and now the last thing I have you do is just bring your your right arm across your body to the opposite side. All right, do the same for the other arm. Okay, perfect. So shoulder flexion, extension, abduction, adduction, internal rotation and external rotation has been assessed, and all of them range of motion. She has full range of motion on all these examinations. Okay. Now I'm going to assess your shoulder strength. So some of these movements I'm going to have you do again, this time against resistance like we've done before. All right. So what I need you to do is I'm going to have you bring your arms out like you're holding a pizza box again. I'm going to put force resistance on the top of your arm. Don't let me push your arm down.
Okay.
Okay. Perfect. Very good. Now you're going to bring your arms out, and now I'm going to push your shoulder down. Don't let me bring your arm down. Perfect. Oh, you're strong. All right. And now you're going to bring your arm down to 90 degrees. All right. And I'm going to try to push your arm out. Don't let me do it.
Okay.
Okay. And now I'm going to put my hands like this. You're going to try to lift your arm out. Don't let me push your arm down. Perfect. All right. And then now you're going to just bring your arm like this. Perfect. And then now I'm going to push. Okay. Sorry.
Okay.
Push. Okay.
Okay.
And very good. All right. So resistance under patient's shoulder strength is 5 out of 5 bilaterally. You did really good with that exam. All right. So now the next thing I'm going to do is I'm going to now just stand behind you. I'm going to just have you bend at the waist a little bit, and I'm going to assess your spine.
Okay.
Okay. So just bend at the waist for me. Yep. And now I'm going to just touch. Okay.
Okay.
Let me know if you feel any tenderness.
No.
No pain.
I don't feel anything.
Okay, perfect. No pain.
No.
All right.
Feels good actually.
Like a little massage. You're funny. All right. So it looks like the curvature of your spine is normal. No tenderness noted. Okay. You can lift. You can stand up straight. Okay. Perfect. So now I'm also going to test the range of motion of your pelvis. Okay. So I'm just gonna put my hands here on your hip.
Okay.
And what I'm gonna ask you to do is for you to lean back for me.
Okay.
Perfect. You can come back up. Lean forward. Perfect. Come back up. You're going to bend to the side.
Okay.
Yep. Perfect. Okay, bend to the other side. Perfect. And now you're just going to rotate your upper body. Look to the right.
Okay.
Perfect. All right. Look to the left. Perfect. All right. Very good. So patient has full range of motion at the hips. Okay. No deficits noted. All right. So now what I'm going to have you do is I'm going to have you, so maybe I'm trying to think what would be the best way, maybe towards this way. So I'm going to go this way. So you're going to stand right over there for me.
Okay.
All right. So now I'm just going to have you walk this way normally.
Okay.
Okay. Perfect. You can go back. All right. So now I'm going to have you walk tandem, what's called a tandem walk. You're basically going to do a heel to toe, like you're walking a tightrope.
Oh, okay.
Okay. So you're
I
just
can do
gonna
that.
You can do that. All right, perfect. Okay, very good. You can stop and go back. All right, so gait, steady gait noted during normal walking and tandem walking. So now I just want you to stand on your tippy toes for me.
Okay.
All right, and walk towards me on your tippy toe. I know, sorry. And you can come back. Very good. Now I want you to go on your heel and then walk on your heels for me.
All right.
All right, sorry, I know. All right, very good. You did great. Very good. So patient was able to maintain steady gait while walking on her toes and on her heels as well. And now last but not least, what I'm going to have you do is just do a nice little squat for me. Like you would do in the
I haven't
gym.
done those in years.
Like that. All right, very good. Patient was able to perform a shallow squat for me. And I think that concludes our video.
Oh, that wasn't bad. Okay.
All right, very good. Do you have any questions or concerns for me?
Nope, you've been wonderful. Thank
All
you.
right, thank you. All right.